Okay, guys, good morning and welcome to NCLEX session part 2. I am Professor Diane Anderson. I have been a nurse for a long time, 25 years to be exact. My area of expertise is mostly critical care, ER, ICU, PCU, MICU, SICU, Neuro ICU, Trauma 1, Trauma 2. But I've also done other arenas as well, and I'll tell you a little bit about that on other videos. Okay, guys, so in this session, I provided 2 questions, which I believe that you will know the answers to. So, test your knowledge and see, how you do. And don't beat yourself up if you didn't get it right. It's okay. As you learn and become more seasoned, you'll get even more better at answering questions, NCLEX type questions, which is really pretty much what we're doing every day in the real world.
First scenario, an adult patient in restraints. A 65-year-old patient with a history of dementia is placed in restraints due to agitation and risk of falls. The patient's daughter asks the nurse why her mother is restrained. What is the best response to give this daughter if you were the nurse? Take a moment to look over the answers. We have A, your mother is restrained for her own safety. B, we are restraining your mother because she is of danger to herself and others. C, we are trying to prevent your mother from leaving the hospital. And D, your mother requested to be restrained. Okay, make your choice, and let's see if you were correct. Okay, so the answer is your mother is restrained for her own safety. Now, restraint should only be used as a last resort to ensure the patient's safety. It's important to inform the patient's family and explain why restraints are necessary. The best response to the patient's daughter is to inform her that her mother is restrained for her own safety. Now, guys, in addition to this rationale, I want to add that what we try to do, especially when it's a patient that has dementia and they're confused, what we try to do is use other methods prior to restraining the patient. So one thing you can do, especially if you're like a night shift nurse, and this is good for the nursing students to know what really happens in the real world. But let's say you're night shift, and we have a patient, what we say is sundowning. That's literally when the sun is dropping, they literally change. The attitude changes, they get confused where they are. They may have been nice to you a few hours ago, and then they're looking at you like you're the enemy because they think you're trying to hurt them. They literally get so confused when the sun goes down. It's a reason why we call it sundowning. Anyway, if you have a patient similar to that, or someone who has Alzheimer's or any kind of confusion that they may try to harm themselves, like jumping out of bed and things like that, where they can break their hip or their arm or whatever, you want to first of all put a nightlight on. Do a lot of frequent checks, what we call it rounding, that bedside rounding on your patient. So that's purposefully going into the room. The patient doesn't have to call you or press the call bell. You're going in there to check on that patient. Every hour really is best, especially if you have a patient that's really confused. So you want to do that. You want to make sure you have mats around the bed just in case they are a fall risk. So if they do fall, they'll have less injuries to themselves because you have fall mats around the bed. You want to make sure your certain side rails are up. You can't have all 4 up because all 4 side rails for most facilities is considered a restraint. So usually 4 rails up is a restraint. Keep that in mind, and definitely check with your facility when you go there to see what their policy is on that. It could also vary based on the unit that you're on. Also, you want to, in addition to frequent checks and having those fall mats at the bedside and around the bed, You want to also talk with your patient. Hey, say, do you have to go to the bathroom? Do a lot of bathroom checks too, because sometimes they're so confused, they don't know to say, hey, I need help with your bathroom, because they may forget they're even in the hospital. They don't know where they're at. Like, where am I? Why am I in this room? This doesn't look like my apartment. So you never know. So you want to go in there and say, hey, can I help you, Miss Smith? Do you need to go to the bathroom? Literally ask her that like every hour. Because if you don't, the hour that you choose not to ask, that'll be the hour that she'll jump out of bed trying to get to the bathroom because she's confused to where she's at. So those are just a few things that you can try prior to doing something excessive like restraints. And of course, remember, you have to have a doctor's order before applying restraints on any patient. And very good reasons for that as well. And you also have to notify the family within your shift that restraints were put on their loved one and why. And all the steps you took prior to using restraints to try to help that patient stay in the bed or not be as confused or not combative, etc. Okay, let's go into the last question. Scenario 2, we have a pediatric patient, age 5, with pneumonia. So the question is, which assessment findings indicate that the patient is experiencing respiratory distress? Take a moment to look over those answers. Okay, we have A, respiratory rate of 16 breaths per minute. B, oxygen saturation of 98%. C, flaring of the nostrils during inspiration. And last, D, heart rate of 80 beats per minute. Take a look again, make your choice. If you have to pause, then pause it. Don't guess, really think this through. Very important. Okay, let's look at the answer. The answer is C, flaring of the nostrils during inspiration. Now the rationale is that if the nostrils are flaring during inspiration, that's a sign of increased work of breathing and respiratory distress in pediatric patients. The normal respiratory rate for a 5-year-old child is 20 to 30 beats per minute. So a rate of 16 is within normal range. An oxygen sat of 98% and a heart rate of 80 beats per minute are also within normal range. So the reason why, again, it's C, because that's that patient's work. They're working hard to breathe, and a lot of times all they'll do is just see those nostrils just constantly flaring. This is really important, especially for the students that are learning and are about to take their NCLEX. Keep in mind something that we already know, the rest of us nurses know from being in the field, that pediatric patients crash quickly. Again, pediatric patients crash quickly, meaning if you see a patient, especially pediatrics, and they're working hard to breathe, and you see those nostrils flaring, immediately do something about it. Call the doctor, get respiratory therapy in there, do what you need to do. Put oxygen on that patient if allowed. Because respiratory distress quickly turns into cardiac arrest with our pediatric patients. They flip fast, very fast. Really important factor to know. Okay guys, I hope you did good in those 2 scenarios and test questions. Definitely like, subscribe, hit the bell for future information. And if you have any questions or comments about tutoring one-on-one or even group services, which is actually cheaper to do group tutoring. But of course you get more attention one-on-one, and it's just the tutor all to yourself with one-on-one. With one-on-one you also get a $50 coupon. But if you have any questions about our tutoring services, or just questions in general, maybe about a paper you have coming up, or a task you have to complete, or just some other concern that relating to nursing, definitely reach out to us. We're here for you. Have a great day, guys.